Sizzling.
All right, we're on your side with some health news today. A lot of folks are flying this summer, but for new moms, having to take their babies along can be a big ordeal. So what might be the safe age for airplane travel for infants? All right, this is an interesting subject.
Yes.
Brought to us by one of our viewers, Dr. Dave.
That's right. Good afternoon, Mike and Jenny. One of our viewers asked, what is a safe age for travel for newborns? And medically, there's no age restriction for travel for otherwise healthy full-term babies. But I and other doctors would discourage unnecessary travel shortly after birth. And most U.S. airlines require that your newborn be at least 7 days old before flight. Some U.S. airlines require 14 days old. And there are several other things that parents can keep in mind for healthy air travel with newborns and infants. And number two is your baby's ears. The change in the pressure in the cabin can cause changes in the middle ear pressure, which can trigger pain. So to equalize the air pressure in your baby's ears, encourage sucking on a pacifier during takeoff and landing. If he or she has an ear infection or ear tubes, check with your pediatrician first before flying in case he's ill.
That's a good tip even if you're driving up into the mountains and they start crying from the ear pressure. So
that's right, Jenny.
Something to suck.
And number three is your baby's breathing. The air pressure in the cabin during flight is lower than on land. Some doctors may recommend supplemental oxygen if your baby has a respiratory condition. If your baby's born prematurely or has a lung condition, then your doctor may recommend postponing flying altogether until he or she is older. Number four is your baby's safety seat. Most infant car seats are certified for air travel. Many airlines allow you to carry your baby in your lap, but it is safer for your infant to be in an FAA, Federal Aviation Administration certified child restraint system. That's either a rear or forward facing seat or a child harness system based on your baby's weight. That means you have to purchase a separate ticket for your baby. Many airlines offer discounted tickets, or you can fly off peak in hopes that you can find an empty seat.
And you'll need it once you get to the next place when you're driving around. You'll need a
That's right,
seat
Jenny.
Anyway.
Transfer it from the airplane to the car. And then number five, finally, medications. If you're planning on giving your baby medications during the flight, make sure you've tested them out beforehand for tolerance.
Good point.
Specific medications, what would you recommend?
Any medications that are prescribed by your doctor, over-the-counter medications as well. You want to make sure that you're tested out beforehand.
But no Benadryl for kids that young, right?
Generally, it's not a good idea to give your baby a sedative during flight.
You can tell I'm not a parent. I do travel a lot, though.
Right.
All right, Dr. Dave joins us every Tuesday here on The Noon Show. And if you have a question or a topic for her to discuss, like the one today, just email it to us at newsdesk@cbs47.tv.